Welcome to the ICC event, the COVID-19 vaccine and the role of business, in partnership with Business Partners to Convince. Our event will start shortly. Throughout the event, we welcome your questions for our panelists. Kindly post in the Q&A. Please also note that we will be recording this session. Today's session will be conducted in English. However, if you prefer to listen to this event in Spanish, please hover over the interpretation icon at the bottom of your Zoom screen. You can click on Spanish to listen to the Spanish channel. Again, kindly note we will be recording this session in both English and Spanish. I'd now like to hand this to Julian Kassam, ICC Global Partnerships and Development Director, who will lead us through today's session.
Hello, everyone, and welcome to our ICC Town Hall on the COVID vaccine and the role of business, with a focus today on vaccine hesitancy. I am Julian Kassam, and I will be your moderator for this event. And today we are welcoming you from Paris with the ICC team and John Denton, our Secretary General. We are also welcoming you from New York with Abby Shapiro from the US Council for International Business and Dr. Scott Radson, co-founder of Convince and Executive Director of Business Partners to Convince. And of course, our special guest from Mexico, the first Vice Chair of ICC, Maria Fernanda Garza. So we will have a number of insights and messages to communicate today. We will have a call to action also, but we really want this to be an interactive session so that all of you can bring their local and regional perspectives to this debate. And we are convening today the global network of ICC, including national committees from all regions, chambers of commerce and industry from the ICC World Chambers Federation. And we have close to 30 countries represented today. So you will hear about an initiative which is championed by ICC's affiliates in the United States, and which they would like to make available to the entire ICC network. And here are some of the key takeaways that you can expect from the session today. So first, what is vaccine hesitancy and why is it such a critical dimension of fighting the pandemic? Second, what is the Convince initiative and what is the role of the private sectors and employers in this initiative? And finally, why is it relevant to you and your local business networks and how you can take part in this program? And this is how we will organize the session. So John will kindly set the scene and remind us of ICC's core actions in response to the COVID-19 pandemic. He will then be joined by Dr. Scott Radson, a world leader expert on health communications and health literacy. He's a lecturer at the City University of New York School of Public Health, the co-founder of Convince and the executive director of Business Partners to Convince. After hearing Scott, we will welcome Maria Fernanda Garza, who will share some key insights from Latin America. And then Scott will move to introduce in more details Business Partners to Convince and tell you how you can take part in this initiative and show leadership within your respective communities on this very important topic. So let's get started. And let me welcome first John Denton, who has tirelessly led ICC's response to the COVID-19 crisis since the very first day of the pandemic, and has led the global campaign of ICC for global access to vaccines and vaccine equity with his counterparts from the World Health Organization, the World Trade Organization, and the wider UN. John, over to you.
Thank you very much, Julian, and welcome. Welcome to all of our participants from the ICC network. It's so good to see so many of you from all corners of the globe. That's the ICC. Let me begin by extending my many thanks to our friends from the USCIB and the USCIB Foundation for both suggesting this event and partnering with us today to put it on. And please allow me to pass my condolences to Peter Robinson, whose father sadly passed recently. We are also very interested in the important question of vaccine hesitancy, including through the Business Partners to Convince initiative. I'm very glad we have Scott Radson, the co-founder of Convince and the executive director of Business Partners to Convince, with us today. He will detail how we might collectively do more to help increase vaccine uptake among our respective business constituencies. But before we turn to Scott, I'd like to use my little moment in the sun here to put this question in the broader global vaccination context. And I'm really pleased to see Maria Fernanda Garces, ICC's first Vice Chair, who will actually later deliver a keynote address examining the main COVID-19 vaccine challenges from a regional Latin and South American perspective. Because I tell you this, if there's one core trend we have observed since the outbreak of COVID-19, it is that while the pandemic is a universal and cruel phenomenon, it has regional particularities that cannot and must not be ignored. The spreading of the disease, the nature of countermeasures taken, the pace, the scale, and the effectiveness of vaccine rollouts, community views on vaccination, and so-called vaccine hesitancy, and of course the overall health and socioeconomic impacts of the disease have all varied significantly, often based on geography and economic levels of development. And so I very much look forward to hearing Maria Fernanda's comments and observations. Friends, today we cannot say that there is one primary challenge or solution appropriate everywhere in the world. And that is why it's so useful to hear different perspectives and have such a broad group, such as you, joining the call today. So let me stress, we would love to hear your experiences on vaccination and what business and the ICC network can continue to do or do more of in order to help. And at the same time, however, the importance of achieving maximal vaccination everywhere in the world is undeniable. We now have incontrovertible proof that vaccines work, they make a difference, that they reduce the risk of infected people succumbing to death or severe illness, and that high vaccination rates are probably the single most important factor in limiting deaths, reducing strains on the healthcare systems, and avoiding the reimposition of restrictive measures. So this is ultimately what will help us get back to life as normal. So here we are at the start of 2022. We may be inching closer to life as normal. Over 9.8 billion doses of various COVID vaccines have been administered, resulting in almost 60% of the global population receiving at least one dose of the vaccine, and almost 50% receiving 2 doses. Many more COVID vaccines will be approved in the next few years, and our arsenal of tools, including tests and treatments, will only grow, largely, of course, owing to the ingenuity of the private sector, that magnificent beast. And as the Omicron variant, highly transmissible, less severe, and rendered even less so by existing vaccines, sweeps the world, many epidemiologists now posit that it will confer herd immunity by natural infection in large swathes of the world in coming months. So on this view, COVID-19 could soon become endemic and dealt with, and we'll have to deal with it differently. But none of this means, however, that we should forget about vaccinating the world. Quite the contrary. Even in that best case scenario articulated above, annual vaccinations will likely be required. New, more lethal variants could yet emerge, and Omicron fundamentally remains a serious disease. Let's not forget that. Especially for those with pre-existing conditions, those who are immunocompromised, and crucially for our discussion today, for the unvaccinated. So it's not time to take the foot off the gas. It's actually time to double down to ensure that everyone, no matter where they are or where they were born, can access life-saving vaccines. The disparity between the vaccine haves and have-nots remains. It remains unconscionable that just 14% of Africans are partially vaccinated and less than 10% are fully vaccinated. Globally, only 3%, my friends, 3% of people have received a booster shot, mostly in Europe and North America. And the frustration and fear felt by citizens in countries where they cannot access vaccine cannot be measured with statistics. We know this. We are in Africa. We are in parts of South Pacific where this happens. And since the outbreak of the pandemic, we have been devoted at the ICC and at the forefront of the global debate, arguing for global vaccine equity. We came out strongly against governments imposing export bans and other trade restrictions on vaccines and their components. We went head to toe with the European Commission when they did this. We argued vehemently for governments to liberalise their trade settings, to reduce tariffs on pharmaceutical products, and speed the flow of essential medical supplies through customs and trade facilitations. We work closely with the WCO, the World Customs Organization, to deliver this. And we made plain the need to preserve the foundational intellectual property framework that actually enabled the development of innovative vaccines in record time, and at the same time encourage dose sharing and a proper funding of COVAX to deliver adequate supplies as quickly as possible to developing nations. Crucially, we've also made the sadly unassailable economic case for a truly global and equitable vaccine effort. I believe we at ICC have been successful in convincing policymakers that the biggest risk to their national economic fortunes actually comes from low vaccination rates abroad, and that the best possible economic stimulus is achieved by achieving high vaccination rates everywhere in the world. I've made that case to the G20, and I've made that case at the UN, and I've made that case at the G7, and I've made that case at APEC, and on we go. We've also made the case for a COVID-19 supply chain monitoring mechanism to enable real-time intervention wherever possible, wherever needed. And we are now embarking on an initiative, which I launched today, to improve the quality of, the cost of, access to, and confidence in rapid tests. This is going to be critical in managing our way through COVID. Large swathes of the world remain unvaccinated, and this constitutes not only a moral scourge, but a vital health and economic risk for every country, given our interconnected global economy woven together by global value chains. And we have also registered the point, let's not forget this, that the cost of fully funding COVAX and enabling broader vaccination and the broader ACT accelerator, costing that and funding that, these are pittances compared both to the cost of economic recovery measures and the return on investment for a world where COVID-19 is actually contained. We will, of course, keep doing all of this, just as we will keep working with the World Health Organization, with national governments and public health authorities to bring in the voice of business wherever it is most appropriate in this whole of society effort to combat COVID-19. Friends, today's discussion will focus largely on what business can do beyond these policy settings. What role can business play in encouraging vaccination among employees, stakeholders, and the broader community? In the knowledge that vaccination is if not the key to successfully managing COVID and therefore getting the global economy back on track. We as the business community must explore this crucial question with the same vigor and seriousness that we have addressed the other aspects of vaccination that I've mentioned earlier. I'd like to now hand over to Scott Radson, who is well qualified, better qualified than I, to lead the next part of this discussion and to talk us through the work of Convince and its business partners. Scott, over to you. And thanks again, Abby and the team, for inviting us to participate today.
Well, thank you, John, and thank all of your colleagues at ICC, not only for your organization, Julian's intro, but also just amazing work that you've done. And thank you for articulating this strong advocacy around the world, as you mentioned, G20, G7, APEC, and so forth, your tireless efforts. And I would like to say, beyond being a diplomat, a corporate diplomat, a diplomat for business and multi-sector engagement, and most impressive. And thank you so much for also reminding us where we are with this pandemic. Today in the New York Times, it's actually reported at WHO Euro saying we're getting close to a stabilization and normalization phase. But in reality, that might be where we are in North America or OECD countries. But as we also know, and as you rightfully called out, a number of countries around the world, namely 88 of them, have less than 40% of people that are vaccinated. So there's lots to do. But it's been most impressive of what you've said. And you mentioned, John, not only the leadership of ICC, but also doubling down on efforts and some new initiatives. What areas do you think are most important now that we might be able to double down with our private sector leadership and engagement?
Sorry, we went on mute there because I was untapping a bottle of water. I was a bit fizzy. Oh. Hey, first of all, again, thanks so much for having us along today. And it's always great to hear the authoritative, thundering voice of the New York Times come across the airwaves. But you know, one of the points that I make, and I'm involved in a number of these discussions, is that learning to live with COVID is not forgetting about it. It's actually adapting behaviours in a way with a level of agility to enable that to happen, actually investing in some new tools and supports for that, which is why I talked a little bit before about this issue of access to, availability of, and confidence in rapid testing. You know, one of the things we've seen even grappling with Omicron, and I'm sure many of the participants today would have noticed this in their economies. I've just been in Australia where the whole issue of transforming the economy from blocking out or trying to achieve zero COVID to living with COVID resulted in quite a significant policy change. But what did not happen was an adjustment to a number of procedures and operational settings to enable that policy change of basically opening the economy up and living with COVID. And what was found seriously lacking there was access to and confidence in tests and testing. And of course, the maintenance of some forms of social distancing, the maintenance actually of a number of the interventions required. So when you think through the way in which we're going to learn to live with COVID, as I said, it's not forgetting about COVID, it's how do we continue to adapt? And what's becoming increasingly clear, and of course you can't say this with certainty, but every 3 months now, and it seems to be quickening a little, there's a different variant emerging. And what people seem to do is once one variant has passed its peak, kind of relax. Now, I'm not saying we should live in a constant state of tension, but like everything, we should be planning for an approach and a mindset and have available the tools that can help us work our way through. We don't want to have to rapidly scale up access to tests. We want to make certain that we have those tests available. And the reason we're very interested in this at ICC is actually we want to ensure that the price of testing through innovation and the ability to scale up is reduced. But what's really important is we grow the innovation to ensure the confidence in those testing will actually take a lot of the pressure off the public health system and enable people to know their status. That's going to be a critical way of working our way through the next iterations of COVID, as hopefully it does lessen its impact, and hopefully, as the New York Times said, does stabilize.
Yeah, I'll give our WH Euro the credit for saying stabilize. I don't know that the New York Times is there yet, and clearly the United States is actually behind Europe and others in terms of adults being boosted. But really good point on reminding us. We all think in quarterly business cycles. And maybe this variant has been quarterly. When you think about Delta Plus, there was Lambda that. If I could say, fortunately, with Maria Fernanda knowing it, fortunately, it was mostly confined to Latin America. And now this Omicron that's going around. And you mentioned testing and knowing the status as an interesting goal and how we all should think about it. We've also called vaccine literacy. But what is your feeling on some of these other, if I can call them schemes, whether they're credentialing, verification, other ways that we've been trying to build confidence in the system?
It's fascinating for us. At one point, I did mention in my opening comments, but I think, Scott, you're aware, I know that a number of people on the call are. We identified very clearly on that the pathway to return of economic growth was going to be enabling global mobility. And so one way of determining the ability of people to be mobile was, again, to know their status and to be able to verify their status. This was never a passport, but we actually introduced in the concept of digital recognition of COVID-19 status. At the time, we were able to focus on PCR testing and antigen testing, and we were able to show by the use of blockchain technology and its the challenges and almost the impossibility of fraudulently applying that it could be applied. And even where we couldn't use blockchain solution, particularly in some developing countries, we were able to develop part of that solution in paper with a double verification by using access to photos and things like that. The reason I'm saying all that is that we realized that in order to shift a policy that would make the world accessible again, we actually needed to invest in technologies. And we trialed and we were very successful, I think. And in the end, our aim was to get policymakers to realize that this methodology or this approach could actually help restart the world and give people confidence. And it did. And what they also did then was develop their own. Like in Europe, the Pass Sanitaire, the Green Pass, in Australia, similar things, in the US, there's different multiplicities. They need to be recognizable amongst themselves. But this is actually digital recognition, the ability to verify someone's status has enabled the world to move to a functionality that I think we would all say we were deprived of for at least the first 12 months. Well, and we started this process, this policy shift argument, within 3 months of understanding the complexity of COVID and how it would play out. And I must say, I'm so glad we did. And similarly, we have to do the same thing about policy settings around tests, though it's a different issue. But you kind of know that you've got to actually argue these cases on a constant basis.
Yeah, I mean, John, thank you again for articulating that in the ICC leadership. I did participate in one of your meetings last year that was on the verification schemes, or as I think you will have now called it, digital recognition, which is what the public is interested in, and business in the way of getting back to economy that we can all operate in. And with that in mind, we've also looked at who's leading some of these efforts. And clearly the private sector with the digital recognition has come up with some of the innovation, but of course, governments and other sectors have to help support that. In this mix, in this world that we're in now, we've also seen, if I can say, a deleterious effect of all the misinformation and all the challenges to our institutions, whether they're the World Health Organization, our business institutions, and others. But yet business continues to poll higher than many of these institutions. So how do we both, one, maintain the leadership and trust, maybe assert it in a strong way, not only locally, but globally, and be able to help really get us out into this next phase? Where do you think the private sector can best engage and lead in this way?
Thanks, Scott. It's a fascinating issue. I mean, the evidence of trust and the loss of trust. It's a subject we ponder and think about a lot at the ICC. We are actually, by the way, considered the world's most trusted business organization. And a point I make, particularly to policymakers, what we've discovered is you move at the speed of trust. So there is nothing that we would ever do that would endanger the trust in which we are held. And so we talk about this a lot. And what we find interesting, when you look at the barometer of trust, and for many of those listening or participating today, you'll know that the annual barometer of trust is revealed in the Edelman Trust Barometer, which has been, I think, been conducted now for some 20 years. With the pleasure of knowing the Edelmans for a while and working with them. And what's interesting from that is that the most trusted entity, or the most trusted kind of voice in the globe is actually business. What that also tells you is that there's a cycle of distrust which is permeating and dominating, I think, the lives of individuals. People don't trust governments. People don't trust even august institutions like the thundering New York Times. People don't trust a number of international organizations, but they do trust business. They trust the person who leads them. They trust the person for whom they work. They trust the person with whom they're engaged on a daily basis, maybe not directly, but within their context, to do the right thing by them. So it's really important for us as business leaders. I'm with the pleasure of sitting on a number of corporate boards as well. And I know there that what we never want to lose is the trust of our employees. But holding the trust of your employees and doing nothing with it is frankly unforgivable. We want that trust so that we can make lives better, to improve their prospects for prosperity and success for their families and to keep their families safe. Which is why it's really important, first of all, that we tell it like it is. We tell the truth. People trust you because you tell the truth. They can rely on what you say. If you say you're going to do something, you do it. And even if it's difficult, you tell people, you explain what's going on, etc. And for me, that's one of the issues which I think you would convince and really hit upon. That it's really an obligation of business. And business leaders don't want to be social leaders or political leaders. But bearing in mind the circle of distrust that surrounds politicians and others, and the need for communities to actually find safety in truth, that truth will come from those they trust, and the people they trust are business leaders, and that's us. And so we owe it to our people to tell it like it is, which is why we talk about vaccinations, why we talk about testing, why we talk about why they're necessary in order to ensure that we can keep the businesses running, give them jobs, make them feel safe, etc. And I don't think it's not like an abstract discussion, it's real. And of course, people look to you, how you model your behaviours, if you say you're going to do something, do you do it? Integrity becomes important, all these elements. And ultimately, that's the role of business. It's to fill this kind of void of trust that's out there, to give people a sense of safety, a safety from the knowledge that the people talking to in whom they invest their trust and confidence are acting in their best interests and giving them advice that they may choose not to take, but they're giving them advice which is well meant, well intended, and well directed.
Yes, and I really thank you for asserting the leadership and trust, and clearly USCIB, not only as your affiliate, but engagement has taken a long approach also on trust, not only with reports and dialogues and so forth, but it's also helped as we form business partners to convince, which I'll talk about next, as you suggest, moving at the speed of trust. And that is something that we need to cherish. And I think that leadership position, that's, as you mentioned, the Edelman Trust Barometer, it's usually released now, when there was the World Economic Forum this week. But also, we've even noticed in the trust surveys that have been done in the United States, most recently with the NBC poll, that the employers continue to come out strong, and we all want to work together with you on that. So, kind of to wrap up what we were calling this fireside chat without a fire, are there questions you have for me? Other parts that we can help engage and work together, not only with Convince, but the whole business network and your ICC work at all levels.
No, thanks, Scott. It's a great opportunity. By the way, I wish there was a fire. It's freezing in Paris, so Paris is not burning, I can tell you that. But I suppose I'm really interested in, you've been leading this with prime focus on the US business community, which is why it's really great to have so many other communities and country representatives involved here. But what's been your experience? Shock? Engagement?
Well, we have Abby Shapiro to sort of the wrap up to talk about the different levels of engagement that we've had in a strong way for many of our business leaders that all are multinational businesses. So to be clear, many are, of course, based in the United States. But we first launched some of this at the United Nations, the High Level Political Forum, which was a partnership forum. It was great to have certainly business there. But I think we've seen, and I think we can say with our closed meeting here, that government and the global agencies and the institutions that we have in place haven't got us to perhaps where we ought to be 2 years into this pandemic. So we have taken as much of a leadership role as we can. We tried not to get too involved in the US, both the political and frankly, there's been legal challenges, of course, all the way to the Supreme Court on mandates and so forth. We're trying to keep the high road, build the trust, get all of our businesses under the umbrella. And I think we have been making progress. And we are certainly looking forward to working with you, working with all the, I think, a number of countries and your chapters and others that are on this call, and continuing to engage business that is not only based in the US, but also around the world. And I think that's what we've seen grow. And while I like to say we're not in early days anymore, we are still in early days as this phase of the pandemic. But I think you well articulated what we need to plan, not only for the future, we need to be having both our eyes on the short term and the long term. And I think that's been our response that we've got. Our companies are stepping up and wanting to engage, as well as the networks that we're so proud to be part of, including the link with ICC. So thank you. Yeah. I hope I've been not looking down on my screen. I, of course, have all of you here. John, it's been, most exciting to speak with you here today. And I want to commend you for your remarks that were really prescient and spot on. And I'm looking forward to hearing from Maria Fernanda as well. But before that, I'm going to give a little bit of background on what we've been doing with Business Partners to Convince, some survey results, and some ideas. Then I'll turn it over to Maria Fernanda, and then we'll still have a chance to talk more, as John had mentioned, about what we can do with Convince. So if we could just go to the next slide, please. And this is just the background of how we established this global coalition. As I just mentioned, we launched this about a year and a half ago. We started the dialogues in March of 2020 with Wilton Park and London School of Hygiene and Tropical Medicine. And those names are people are at the bottom: Heidi Larson, who's one of the world's expert in vaccine confidence, and Nancy Lee at Wilton Park. And we co-founded this with the idea that we would have different sectors involved. And I'm not going to read all the parts in the Venn diagram on the left, but the most important part is we were aiming in the center. So how we can already, when we knew where we were before there even was a vaccine, and that was going to be our way out of it. So our mission, as it says in the top right, is to provide a forum and clearinghouse for multi-stakeholder efforts to manage this complex, nuanced, and immense public health challenge. And we envision a world where society accepts and trusts the importance of vaccines to keep people healthy and the global economy functioning. And when we established this, we thought there would need to be 4 streams. One was the healthcare workforce, the second, media and technologies, the third, community engagement, and the fourth, private sector. And we organized as business partners to convince, which we lead. I'll just mention, I'm not going to talk about the other work streams, but for the most part, those have found their way with both NGOs and community organizations and others. And they're not organized in the same way, but many of them use the Convince umbrella. And for example, the one up in Canada is quite active in all of these areas. If we go to the next slide, it shows when we did launch this, we also spent some time when we first announced this publicly in the Financial Times in August of 2020, of the very important role of business, as John has articulated and all of you know. And I like to read this, and I know we have this also translated if you are on the interpretation. Business is a trusted source of information, well suited to engage, inform, and educate workers, their families, and communities with a message that inspires confidence in vaccination and encourages acceptance and uptake as COVID vaccines become available. Therefore, we pledge to hear concerns, listen to feedback, and develop vaccine literacy strategies based on science, facts, and emerging information to counter hesitation in vaccine opponents through communication and education initiatives at the global, national, and local levels. And frankly, that's what we're trying to do today. There are a number of logos, many of which the International Organization of Employers, of course, the ICC, Business at OECD, and some of your affiliates, the Australian Chamber of Commerce and Industry, and others, which here. The Society for Human Resource Management is a very good partner as well, and working on the training and some of these other areas that are on here. But I think this is just a snapshot of where we were some time ago. We have many other organizations. And as I mentioned earlier, both the community efforts with Business Fights Poverty and others have inspired us to keep our business partners to convince activities going and participate in a number of dialogues amongst these other organizations in different parts of the world. The next slide reminds where we were early on. We had announced this in July at the UN High-Level Political Forum. We then put out the organization of the shared purpose that I just read, and then we had some coverage both in the Financial Times and later in CNN. But at this time, it was clear to us that while vaccine hesitancy was already termed a top 10 threat before COVID actually hit, this was on the WHO and global agenda. Nonetheless, we knew it was going to be an obstacle, and the work that we've done was in fact ahead of the game, but yet at the same time, it wasn't helped by the governmental efforts. And I was quoted here by saying warp speed and the Sputnik space race of the Sputnik vaccine out of Russia didn't help at least us on the vaccine confidence side, and gave some fuel and oxygen to the vaccine hesitant and vaccine skeptic. The next slide shows where we thought the world would be. We supported USCIB, amongst other groups, supported a global study in 19 countries that we did very quickly in June of 2020. And we had a sophisticated score. This was with our colleague Jeff Lazarus at IS Global in Barcelona, Angus Bingawaho in Rwanda, former health minister. We had the former EU Commissioner for Health also on the survey. And we looked at 19 countries and also 20 different measures of how the governmental response was going. What we found that was clear in this early response is the better countries were doing if they had trust in government. And then there also was how they had trust and association with all of the messages. And we did find, of course, if you had a more trustworthy government, trustworthy society, you would have a better response. We published this, and then we also broke down a number of the questions that were later published. And the next slide will show where we were in 2020. If we could go forward, please. And this we published a couple months later in Nature Medicine. And what was most important is this was the beginning of showing that, even if a vaccine were available, a significant amount of the public would not take the vaccine. So in societies such as China, Brazil, and South Africa, it actually was pretty high. But on the negative side, as you see on the far right, France, Poland, and Russia were very low. But I'll say now, not only saying this was a snapshot of where we were in October 20 or in June of 2020, the good news is that we were able to move many of these up, but also many of these went down, unfortunately. So we reviewed this again in the next slide. We'll show that we thought there was upside potential. As I mentioned, we not only were looking at the measure of people's willingness to take a vaccine, but also how much they thought that the government and business was working together. And of course, it's a little bit skewed in China, where business and government are one of the same in many places. So they were over 80%. But as you could see, a good part from the UK on downward from 52%, a good part of the world, or certainly the OECD countries, didn't think the government and business were working well enough. So we were using this again as advocacy, listen to business, have more engagement. That will help get us out of the pandemic and address appropriately. And the next slide shows that while we were doing that, there were other studies that were being done and conducted. This was by colleague Heidi Larson, who again was part of the co-founder of Convince. And you could see that many people were hardening on their interest in getting a vaccine. So the red are the bad parts, if I can say, that people would definitely not get vaccinated. And that was led by Lebanon, Pakistan, Paraguay, France still having some strong anti-vax movement. And still to the bottom, you had some of the countries in Asia, again, that people were willing to follow what was either trust in government or trust in the message. So again, we showed there was a huge problem of getting vaccination to a level that we would need to confer herd immunity or the protection that we wanted. So we continue to try to just show some research that was out there. The next slide shows we repeated our survey of what we did in June 2020 that I just showed in June 21, and we added a few other countries. And I think the bottom line is last year in June 2020, I'm sorry, now over two years in 2020, we thought that 72% of the people globally said they would be willing to take a vaccine. There was no vaccine yet out. So that was hypothetical. We were able to increase that to 75% around the world. Now, this is just we collectively by the announcement of trustworthy vaccines, if you believe the Pfizer-BioNTech, the AstraZeneca, and the Moderna vaccine that were basically approved in the US and UK, many OECD countries, as well as, of course, the other vaccines that have been recognized by the WHO. But even having said that, it wasn't increased across the board. The United States had a 9% drop of people willing to take the vaccine for those not. And I would argue, and others might say, it's because of not only the vaccine skeptics and the distrust in government, but also very organized approach of questioning science. And one might also say stumbles on some of the communication from government agencies and others. But you could see, for the most part, other countries actually did better. France moved up from 59 to 64%, and today they're leading with a lot of good policies and engagement. And others, moved up. China from 88 or 89%, nearly to 98%. So there was some movement, and many regions, Brazil moved up and others, most part, it had improved. The next slide shows, though, that, I am quoting the New York Times, as John mentioned, they are still powerful as an agenda setter. And the former head of the CDC said, no, we're just talking about hesitancy because it's a good story. And if you give the media a good story and you see the pushback of people pushing back the syringe, you get what should be 99% of people or science that says vaccines are a good thing, and the vocal 1% get a larger share of voice. And the next slide shows that it is a problem, but we did some research that showed it's really not the problem, that we should just say everybody is vaccine hesitant who are not vaccinated. So we published this article. Again, I have an academic position working in New York, and worked with some colleagues. This is about 140,000 adults in the US. When people were saying they were hesitant, and they really weren't hesitant, they just weren't able to get a vaccine. And as Tom Frieden said, the problem was access, and we still have the problem of access around the world, that there are people that aren't hesitant. They just need to be able to get a vaccine where it's easy to get, where it's recommended by whether their employer, their religious or other social groups, or made available by their doctor or healthcare provider or community health worker, or wherever they might be. So we are trying not to use the word hesitance and use the word confidence. And I think we can do that. And I'll just read the quote because this is exactly what we said in the survey. Policymakers have focused on vaccine hesitant groups in national polls. Although this characterization is useful first approximation, it underestimates variability in stages of readiness, the fluidity of people's views, and the persuasive power of access to health professionals embedded in the communities where people live and work. Our message here was, this was a New England Journal of Medicine, a medical journal. We wanted to get the medical community engaged. And you'll see later with a couple of articles that I've written with others and alone with our business partners to Convince, we try to articulate the business community in places where the business community listens, whether it's the Financial Times or BBC World News and so forth. The next slide also shows data that we've been looking at that we thought it was important that we understand whether they're vaccine mandates or vaccine requirements. And we asked very quickly, do you support a requirement for vaccine? And the average of people supporting their employers is actually pretty high. Both employers and government were the same, whether it came from the government saying the vaccine mandate, we want everybody to be vaccinated in the country, whether it's government workers, all the way down to private sector, as well as if they just would listen to their employer. And we saw this play out early on in some companies, whether it was United Airlines getting 99% of their people vaccinated with mandates, or other governments where they were able to very quickly get people at least back to work or vaccinated into a level of confidence. And this was pretty strong in most countries. You see there, they are linked. It's only really, again, the United States actually, which has over half of the people would support their employer more than they would support the government. So I think the vaccine skeptics and the people who have challenged it realize that, and they've driven the wedge, including a march on Washington, or at least a rally, I should say, on Washington on Sunday, that were actually not protesting vaccines, but protesting governmental vaccine mandates. Similarly, there were about 50,000 people in Brussels that were also protesting to a level where the Belgian government had to use tear gas, also against vaccine mandates. But really, those are a minority, as you see here. And the majority of people do support a requirement. They would like, for the most part, as you dig amongst this, to get back to the normalcy that John articulated so well, and maybe the stabilization and normalization that WHO is talking about is on the horizon. We go to the next slide. We also wrote this, as I mentioned, not only we're writing to the medical community and the public health community, but also the business community. And along with colleagues at Harvard Medical School and a colleague at Convince, Ken Rabin, also at City University of New York, we wrote that the private sector's committed engagement to build trust in science through an aligned commitment to health and vaccination through multi-sectoral efforts. And a lot of the other work that Rebecca and Julie have been doing continues to have interactive websites and ways that businesses can forecast and project the potential of their policies on their business related to COVID. The next slide, again, we've articulated in the Financial Times. Employers have an important role to play. These two articles that I wrote also are building on the surveys that we've been doing, reminding both in 2020 and 2021. And then I've been fortunate to be quoted in many of those others in the BBC World News. It was on a business channel, and we'll show you later in some resources where you can get access to some of these, as well as some that I've also done in multiple languages, despite English being my mother tongue. There have been some places where this has showed up, whether in Latin America or China. And then finally, we asked the term vaccine credentials in this 23-country survey this summer. And John articulated very well the digital recognition. And as you can see, for the most part, people are supporting vaccine credentials for international travel. And this certainly has been put in place by the competent authorities, certainly in Europe, Asia, Latin America, around the world. But this is for international travel. We later asked this for domestic travel. Canada it is in place in domestic travel. You need to have credentials. It's not the case in the United States. But if you look at the number of countries here, for the most part, the support is well over 60%, and the U.S. being at the 62% on the far right. But a good number of countries with the strong support, with over 2/3 of the population. And then what do these look like? Is this, this what I call, and I still have, what was 20th century technology, and some might even argue even worse than 20th century technology, the yellow fever vaccine card. Is this what we can do? We can certainly do better. And I know that, many of you have been working on these. This is just an example. What kind of schemes will we need? How, whether it's at the employee level, the governmental level, going into restaurants, whatever it might be, and how do we imbue that confidence? And that's what we hope to do with our efforts. And finally, right, this is our reality. Helen Clark, former New Zealand Prime Minister, stated in chairing a World Health Organization group over a year ago, current institutions, public and private, fail to protect people from a devastating pandemic. Without change, these institutions will not prevent a future one. We know that these organizations, both the Bretton Woods and other ones, have been set up in ways that maybe are not clearly ready, according to this group. And obviously, business is always evolving. We need to innovate and to survive, and also to help make a difference amongst our publics, keep our employee trust, and our role in communities. So, I'm hoping to work together with all of us. I will be coming back, into this discussion with the efforts that we put together with Convince. But this was laying this out in the vaccine hesitancy, some strategies. I'm really excited to hear now from Maria Fernanda Garza, and again, thanking both her leadership with ICC. And I'm going to turn it back over to Maria Fernanda and Julian for certainly this exciting part of this webinar today. Thank you.
Well, Scott, we want to thank you on behalf of everyone here, and thank John for setting the scene so brilliantly and providing this amazing data points that bring so much nuance, to this very complex problem. We see all the socio-economic dimensions, health communications, and so forth. And we received a few comments on the chat, some interesting insights from Argentina. And I know we have other participants from Bangladesh, from Turkey, from Nigeria, Switzerland, Chile, and others. So if you'd like also to share, your perspective from your region on that chat, it will really help us bring more color to our debates. But now let's move to what we are all waiting for, which is the intervention from Maria Fernanda Garza. I think Maria Fernanda requires no introduction, of course, to the ICC network, but just to say she's a businessman from Mexico, and one with a deep engagement in improving the business environment, but also valuing the contribution of business to society. She served as chair of ICC Mexico for many years, ICC regional coordinators for the Americas, so is a real champion for our ICC network. And she's now first vice chair of ICC. And she will give us today her vision on access to vaccines and vaccine confidence in her region, Latin America. And you will see some very interesting insights that she will share with all of us today. Maria Fernanda, over to you.
Thank you, Julian, John, Scott, and all our colleagues at the USCIB, particularly Peter Robinson, who unfortunately couldn't be with us today, but he, along with his colleagues, make this important discussion happen, and we thank him for that. And I am honored to have been asked to deliver this keynote address, which, as John foreshadowed, I would like to use to provide the view from Latin America, which I have been greatly aided by my colleagues across the region in providing statistics and information about the experiences in their countries. It will probably come as no surprise that the experiences of COVID-19, vaccinations, and vaccine hesitancy differ markedly in Latin America to those in North America and Europe. And I hope that by delving into the regional needs, challenges, and outlooks, that we might not only be able to shed light on what ICC and business more broadly can do in this part of the world, but also offer some lessons or at least thought starters on how other regions might respond to. Allow me to begin with the vaccination situation in Latin America. Infections have been rapidly increasing across most of the region in recent weeks as the Omicron variant continues to spread. There is significant variation by country for total vaccination rates. Chile, for instance, is on the top of the leaderboard and has given at least one dose to 91% of its eligible population, while Argentina has vaccinated 85% and Brazil and Colombia 78%. Other countries lag behind. Venezuela, the Dominican Republic, and my own country, Mexico, have only reached vaccination rates in the low 60s. Overall, Latin America is among the world's most vaccinated regions. But many epidemiologists say that it remains particularly vulnerable to Omicron. And this is due to the slow administration of booster shots and the high reliance in some countries such as Argentina, Chile, and Peru on Chinese vaccines, which have shown to be less efficient against the new variant. Beneath the varied vaccination rates, we are also experiencing a wide variety of government interventions aimed to suppressing the Omicron wave. I will mention just a few measures to give you a flavor of this variety. On the more liberal end of the spectrum are Argentina and Mexico, that despite record cases in recent weeks in both countries, Argentina has refrained from imposing movement restrictions and is even promoting domestic tourism via cash credits for travelers. Similarly, Mexico has remained open to visitors and has had a strong tourism season, although this has correlated with higher case numbers and having the president and several cabinet ministers tested positive for a second time. Other countries have adopted stricter measures. In December, Peru imposed a nighttime curfew and tightened capacity limits in public spaces. Ecuador has delayed all in-person schooling until February. Bolivia will require a vaccination or a negative PCR test to access most public spaces. Meanwhile, in Brazil, many cities have had to cancel carnival parades and street parties, and the health ministry is still reeling from a hack on its reporting platform. I have spelled out these variations in vaccination rates and non-pharmaceutical interventions, not only to illustrate the health situation, but also because both are having quite severe economic consequences, which of course matter significantly to the business community. At the highest level, Latin American economies, which grew by 5.9% in 2021, are expected to slow down to 2.9% in 2022. And despite the positive rebound of last year, the reality on the ground was that consumers actually saw the prices of staple goods continue to rise. Similarly, GDP per capita is not expected to return to pre-pandemic levels until 23-24. And extreme poverty in the region has risen to its highest levels in 20 years. The Gini coefficient, our best measure of economic inequality, has grown by 2.9% since the pandemic began. But recent analysis show that it would have grown 5.6% in the absence of government programs such as non-conditional cash transfers. In short, Latin American economies are barely growing, while poverty and inequality are on the rise. So even though regional vaccination rates are actually relatively high, the inefficacy of some vaccines, the resort to more restrictive countermeasures, and the challenging economic situation all point to the need to increase vaccination rates as much as possible. And there are, of course, multiple factors that have so far prevented vaccination rates reaching even higher levels. Chief among these is poor distribution, just as Scott was mentioning. Barely anywhere has the private sector been enlisted to assist meaningfully with this titanic task, despite so much experience, capacity, and willingness residing in companies across the region. But again, differences between countries predominate. Brazil, despite a late start, now has no major challenges in distribution. Costa Rica has authorized the private sector to buy vaccines, but they have not yet done so, and booster programs have barely begun. Guatemalan business report that the process of acquiring vaccines by governments remains slow and uncertain, with vaccinations only taking place so far in the capital city. And in Mexico, the government's monopoly on distribution has limited its effectiveness such that only 56% of citizens are fully vaccinated. But in a bright spot, in Peru, where over 90% of people are double vaxxed, the private sector has been provided logistical support to the state to assist distribution. Even though there remain challenges in getting vaccines to remote Andean and Amazonian regions where many indigenous people live. Accordingly, at least in early 2022, the main role the Latin American business community can play right now is to better embed ourselves in our government's vaccine delivery strategies and assemble our resources to get as many of our citizens vaccinated as quickly as possible. The Peruvian experience may well be one to aim for. And this makes the situation in Latin America very different to that of Europe and North America, where distribution no longer poses significant problems. And the biggest issue now is convincing and cajoling the unwilling to get vaccinated. And this is not to say that there is no vaccine hesitancy in Latin America. Rather, it does not seem as prevalent as in North America or Europe. Let's look at some figures. In Brazil, it's only 3%. In Costa Rica, between 5 and 6. In Mexico, 7%. And in Peru, 10%. For the majority of countries in the region, vaccine hesitancy rates do not appear to represent the difference between potentially reaching herd immunity and not. Also, unlike Europe and North America, Latin America does not have significant anti-vax movements. The result is that widespread vaccine hesitancy does not pose the chief threat to achieving maximal coverage, at least for the moment, while distribution remains the single biggest concern in most countries. However, once the distribution challenges are ameliorated and dealing with, remaining vaccine hesitancy becomes a higher order concern, and we must address the issue by giving special regard to the particular Latin American flavor of vaccine hesitancy. Again, it is not just the quantity of vaccine hesitancy is different, but so too is its quality. And this should come as no surprise given the very different context. After all, unlike Europe and North America, Latin American countries are vaccine receiving rather than vaccine producing countries. Pre-COVID studies show that Latin Americans prefer locally produced vaccines to foreign ones, but these do not as yet exist for COVID. Many Latin American countries rely, at least in part, on COVAX deliveries. And more broadly, at least before the pandemic, citizens in Latin America tended to be less informed about issues related to public health, possess lower trust in science, and live in countries with weaker healthcare systems than in the US and Europe, all of which affect general background's attitude towards COVID vaccination, some positive and some negative. And at this point, I would like to highlight a few interesting findings from an early 2021 study in the scientific journal Nature. In this survey of 2,000 adults in Argentina, Brazil, Chile, Colombia, Mexico, and Peru, the authors discovered several trends. First, vaccine hesitancy in Latin America is not uniform. Rather, it proves highly responsive to which vaccine is on offer. Second, Latin American citizens privilege Western-produced vaccines, somewhat worrying given many countries in the region have procured a diverse portfolio, including non-Western ones. And third, giving citizens information about a vaccine's efficacy could successfully counter suspicions of non-Western vaccines. The first finding about vaccine hesitancy being not uniform also applies to the role that business has been playing in response. In Brazil, the government has prohibited companies from demanding vaccination from their employees, although there is a movement from the private sector to encourage vaccination. In Costa Rica, the government has made vaccination mandatory for public sector workers and allows private employers to demand vaccination from their employees and intends to establish a vaccination pass system to enter commercial and recreational establishments. Mexican labor law prohibits making vaccination mandatory, and the business community has only been able to make appeals in favor of vaccination. While Peruvian employers may suspend employment of an unvaccinated worker without paying remuneration if they cannot perform remote work, the role of business has been largely shaped, as we can see, by government decrees. So where does that leave us with vaccine hesitancy in Latin America? Each country and each business community must adopt an approach tailored to its individual circumstances. We can and must focus our efforts on getting distribution right. But at the same time, we must take steps to address the less urgent but nevertheless important issue of vaccine hesitancy if we are to get as close as 100% uptake as possible. And this in the Latin American context can be partly done through making plain the efficacy of vaccines, traditionally a role for public health authorities, but one which perhaps business could supplement where appropriate. Thank you very much for the opportunity to join you today, and I look forward to the rest of our discussion. Back to you, Julian.
Thank you so much, Maria Fernanda. This was really fascinating what you've shared with us, but also the roadmap and the creative approaches you are suggesting, having the business sector play a role of leadership. It's something I think we all agree upon. It is a health problem. It is also an economic problem. It's becoming a social problem, as we know. So this is what you've been presenting is really perfect for the next as a transition to the next segment, which is how can we get organized for action. And this is what Scott is going to present now, is how you can effectively use the resources made available by business partners to convince, and the workplace challenge, which you can then implement locally with the support of the team at Convince. Scott, over to you.
Thank you, Julian, and really thank you, Maria Fernanda, for not only great reality check of where we are, but also just amazing ideas that it would be great to see put into play for both short-term and long-term success in the region, and also examples for global attainment. So, there's lots to do. And, as we mentioned, we had focused on vaccine literacy and having all of us involved. And just as a recent quote by Dr. Tedros, who said, "I need to be very clear, vaccines alone will not get any country out of this crisis. It's not vaccines instead of mask, distancing, ventilation, or hand hygiene. Do it all, do it consistently, do it well." And, as we've articulated here with John from the outset, Maria Fernanda, and the work that we're doing, we're trying to give the tools and the wherewithal and the long-term ideas for this. So here's one example, and we'll put this in the chat if you would like to come next week. We have business partners to convince, which calls themselves 19-0. Dr. Jiahu, who's also done a number of research studies, not only in Canada, but is a really excellent resource looking at what's been going on in Canada, and we'll try to moderate and bring some ideas forward. You're all invited to that. But we also have other pieces that are on our website. I will come back and mention this workplace challenge in 3 slides. I'll show you some of the employer resources, a challenge toolkit, media and press releases to support. And I see already we're putting the registration in the chat. The website resources are all updated and also are archived. So SHRM, the Society for Human Resource Management, continues to update their COVID-19 and vaccination resources. They're a global organization which serves as a partner with us. We have myth versus fact sheets, very short, 1-pager, a couple languages, and so forth. And then we also highlight what some of our partners have put forward. Merck, which does not have a vaccine, as you know, for COVID, but is a long-term partner in building vaccine confidence, actually is already giving some resources of what to do for children's vaccines and others, the flu vaccine that people may have forgotten. So there are some resources. And then the most important resource of all, we've collated and put all together. As you can see on the right, we have this in English and Spanish, the Global COVID-19 Workplace Challenge. We have the opportunity for companies to join this, and I'd like to read the pieces because we've been very careful working with IOE, with Julian and ICC colleagues and others of how we term this and how we give business the opportunity to lead and also to engage meaningfully and build the trust that John and others have mentioned is so key. 1, listen to employees' needs and concerns about the impact and prevention of COVID-19. So we suggest ways that companies and employers and business can have 2-way communication for listening to employees' needs. 2, follow the latest public health guidance to protect myself, my employees, my workplace, my customers, and my community from COVID-19. We are not suggesting that the business has a different set of facts. We believe the science and the facts as they evolve are the latest public health guidance that companies can work together and follow. 3, promote vaccine literacy based on the latest scientific evidence on vaccination benefits and risks. Maria Fernanda outlined this very well, that we need to have people understand where the vaccine is and the different vaccines, and also even going down to, in some places, in some cases where they're manufactured, and how they both have benefits and benefits that outweigh the risks, but nonetheless we can't shun and not say there are no risks at all. 4, encourage vaccine confidence and uptake, and that means making it easy to get vaccination, making access available, and building confidence that it is preventing disease that we've seen happen around the world. Advocate for accessible, equitable, and timely vaccination of employees. Again, the tireless efforts of ICC and all of you on the access and equity. We think we can do that, but that's an advocacy role, and we know advocacy takes time, and it's something we always have to be close to our hearts and our innovative ideas. And then finally, we can't do this alone. As the Tedros quote reminds, we engage with communities, schools, faith-based organization, public health leaders, and others to help stop the spread of COVID-19. We've collated this, we've curated this, we've put materials that are all on this challenge. We have the opportunity for two-way communication as well. If you join the challenge or any of your members join the challenge, we'll be able to highlight. We update with newsletters that Kira and others can give you signups for that you can get. And there's ways that we also, cross reference and the work that ICC and IOE and others are doing as part of our network. So we hope that you all consider this. And with that, we have a few minutes for question and answer. We often try to get this in the chat. But Maria Fernanda did a great presentation of all. I'm here for Q&A. I think I'd also like to have the opportunity, if there's any other burning questions for our great speakers that we've had. And then finally, at the end we'll turn it back over to Abby Shapiro just after a few minutes here, and then Julian to help wrap up.
So Scott, I'll begin with the Q&A. The first question is, how should employers speak to their employees about vaccines? And related to that, what strategies work?
Well, thank you. And Kira, and what we've tried to put together, with USCIB and business partners to convince is, shall we say, a toolkit that there is no one size fits all. But we do know that open and ongoing communication, and as John well said, you build trust by telling the truth, you build trust by sharing the facts, you build trust by embracing, shoulder to shoulder approaches. And, some of those specific messages are there, but it's not just messages, it's the messenger. And, I think that's what's so key here, of the trust that, we're all trying to embody. And, both John and Maria Fernanda said so well with their leadership with ICC.
Great. Another question is, what other countermeasures are important other than vaccination for the health of their employees?
Great. And then, thanks. We mentioned, and just as the Tedros quote, right, we still have, there's no reason we should get rid of hand washing. Hand washing isn't going to get us out of this pandemic. We certainly know that the masks matter, and the kind of masks matter, and the access to masks matter. And then, of course, the social distancing and the idea of building confidence with whether they're credentialing schemes or other pieces. But, I don't know if John and Maria Fernanda would like to answer or add anything on this one, or if I know you may have a final question, Kira, and or any other comments here.
Not at the moment, but if anyone else from the chat wants to raise anything, I'm happy to raise that question. Just give someone a moment to write it down. Not seeing anything, so I think we can move on.
Great. Well, I wanted to, again, really, thank everyone who's participating. I know you all have networks and leadership roles, and I remind everyone, and I answer those questions quickly, that we're all not only business leaders, but we're community leaders. We have family and friends and people that we care for and have a role in society. And I think that's what's motivating all of us through our daily lives. I really want to thank Maria Fernanda for really deep insights into Latin America, deep insights into looking beyond not only the numbers that are real and are there, but unique ways that business can step up. And it's really with that I think we've got a unique group with business partners to convince. We've got some great strength with the networks that ICC, USCIB have built over these years. And I'm fortunate and honored to be part of this. So I really want to thank all of you who have participated. John, directly without our fire, we will do this in person someday. We will all be back, Maria Fernanda, wherever we may be able to meet. I know we talked at the outset of many of you getting together shortly, but I am hopeful that 2022 will be better. And I think it will be better by the work that all of us do with Convince. So I want to, again, thank all of you for participating today. I'm going to turn it back over and again, thank Julian and Abby for the great work. And that's all. Keep at it, and best for our 22. And it's great to kick this off all together. Thank you.
Thank you, Scott. And I would like now to give the floor to Abby Shapiro. Abby Shapiro is here representing Peter Robinson, and really she's the champion of the Convince initiative, and has been working with me and with other business networks to make it wider known in every region of the world. And we really see this meeting as the great opportunity to introduce the initiative in more details, but also leave you some very practical examples of what you can do in your network. So now I would like to invite Abby to share a few words and inspire her colleagues to follow the lead that we've seen from the US.
Oh, thank you very much, Julian. It's my pleasure to be here today and to be among our colleagues and our friends from ICC. We keep referring to ourselves as USCIB, but we actually are ICC USA. And so thank you. Thank you, Maria. Thank you, John. Thank you, Julian. I want to express our thanks also to Helene and Tina, who have given us such tremendous logistical support. But I'd like to talk just very briefly, because so much has been said today, about the purpose of Business Partners to Convince. The purpose of Business Partners to Convince is why we're here today. None of us can do this alone. We built a network, which you saw earlier in the slides that Scott presented, so that we would be able to energize those networks to reach into their members and their members to reach into their employees, to begin to talk about vaccines in a way that was not judgmental, but was based on science and the need to vaccinate the world in order to get the global economy moving again. And so being here today with all of you gives us that opportunity to introduce Business Partners to Convince and invite you to join us. You asked, John, what could ICC do? Well, what ICC is already doing is enormous, important, valuable, and a way to be able to help us reach the larger entities, government, and the advocacy community, the policy community, to make changes that are absolutely necessary. Our focus at Business Partners to Convince is a little bit different. It really is on the role of employers and what they can do in their own community and their own business, whether large or small. And each one can make a difference in trying to understand, listen to, prevent misinformation from taking hold, and taking the time to develop programs. So Business Partners to Convince, I hope it's been put into the chat. I invite you first, take a look at the website. There's a lot of opportunity there to answer the question, how do I start? What do I say? When someone is resistant, how can I help them understand? This is not about mandates. This is more about education. It's more about compassion. It's more about seeing that employers have as much of a role to support their employees as the government and the public healthcare community does. So take a look at Business Partners to Convince and the website. Then take a look at the challenge. Scott referred to it. Why a challenge? Well, we're in an era where media is everything, and the media has not been very kind in many ways to this pandemic or to what's been happening. But the challenge is an opportunity to create a movement among employers that says, I understand and accept my responsibility to help my employees understand why vaccinations are important, and particularly vaccinations around COVID and the variations that have come. So I would suggest that you take a look at the challenge. If you want to join, there's no cost. You simply take a look at the opportunity and the things that we have on the website to help you implement it. And be proud of being able to do that, because it makes a statement. It basically says you understand and you support that role. And then send me an email, send Scott an email. We'll put our contact information in the chat. We'll help you get started. You know, the ICC network has the capacity and the reach to really make this a global effort, and a global effort that is not redundant or not an afterthought to what you are already doing and know what to do and are engaged. This is simply one more step in getting employers of all sizes to say, I'm part of this and I want to participate. So thank you everybody for coming. Thank you so much to ICC for giving us this opportunity to address your network. We're ready to help and support in whatever way we can. But we can only do so much. We need people to raise their hand, and then we can get more engaged on a one-to-one basis. And we're ready to do that. Julian, I'm going to turn it back to you, unless there are some questions for me.
Thank you, Abby. Actually, Maria Fernanda, I would like to rebound on what we've just heard. Maria Fernanda?
Thank you very much, Julian. And thank you, Abby, for your words. And I can only support what you said, inviting all of our national committees and asking Julian to send the information to the chambers of commerce as well, because all businesses in the region should be part of this project. It is so important for not just for the business community, but for the whole region, given the circumstances that we saw. So I would like to see a strong effort, because it's for the good of all of us. And we have something in particular that Scott mentioned, and it's that we can move at the speed of trust. Among our ICC network, we trust each other. We know that we are here for one particular reason. And so we have that advantage that other organizations or other institutions do not have. And it's the trust in each other. So let's take advantage of this and move at the speed of trust. And we can see, because of the situation of particularly in our region, maybe we can reach the herd immunity before any other region in the world, if we can work together, the public and the private sector.
Thank you, Maria Fernanda. And with these words, I think we're now going to close this session. But as we've just said, this is actually the beginning of hopefully more interactions, more engagement from the network. We know this is a immense public health challenge, but many people are looking for business to take the lead. They're looking to institutions like ICC. They're looking to the local business networks we all represent, so that we can get back faster to more resilient economies and overcome these challenges. So thanks all of you for your participation today, the very insightful presentations. And please stay in touch and don't hesitate to write to us. We'll always be happy to direct you to all the resources you need in order to bring this to your country and markets. Thank you all.
Thank you, everybody.
This concludes the ICC event in partnership with Business Partners to Convince. We thank you for your participation and have a wonderful rest of your day.